Joining me today is Dr. Marc Siegel. He's a professor of medicine at the NYU Langone Medical Center, as well as a Fox News medical contributor. Dr. Siegel, thanks so much for joining me again.
Hi, Samantha. How are you?
I'm doing well. I so appreciate you joining me today. And the first order of business I want to talk about is a vaccine passport. What are your thoughts on this? And, do you think it's a good idea or not?
The word passport puts people off, but I like the word incentive. So here's how I look at it. Where are you already restricted? Where are people saying you need a test to get in? If you don't get a test, we're not going to let you in. Well, the problem with a test to get in, you want to go here, you got to have testing. That's cumbersome, it's inconvenient, and it's not accurate. You know what is accurate? A study that came out today that shows that if you have the second dose of the Pfizer or the Moderna vaccine, you're decreased risk of spreading this or getting infected by 90%. And it's probably even greater than that. So the point is that vaccines are a reliable predictor of decreased risk. I think we have to use that as an incentive to get the rest of the country vaccinated without penalty, without using it as a rate limiting step. And let's add to it having had the virus itself. Why is it that when people get over COVID and they have a natural immunity, which has been shown to be pretty powerful, why is that not on the table? So I like the idea of rewarding people for being less of a risk in our society without interfering with patient privacy issues. It's tricky. How can we do it without the government or Big Brother keeping track?
How do you think we can do it? I mean, you have the Florida governor, Ron DeSantis, calling it completely unacceptable for either the government or the private sector to impose upon you the requirement that you show proof of vaccine just to simply participate in normal life. So where is that balance between, protecting public safety, but also not infringing on people's individual rights and liberties?
Really, really good question. And I'm a fan of Governor DeSantis and how he's messaged through the pandemic. I think the answer would be what I kind of was hinting at, which is let's restrict it to places where it's already an issue. So in other words, if Hawaii, if I want to go to Hawaii and Hawaii's not letting me in without a test, and they say to me, "We'll take a vaccine, proof of vaccine instead," how is that any different than a regular passport? So I think there's certain areas where I think it should work rather than an across the board situation. If you prove that a place is problematic, that a place is a risky place, if you're in an area where there's a risk, then having the vaccine, proof of vaccine could be helpful. People don't ask me my driver's license when I walk in the door, right? The cop asked me for it when I'm speeding. So that, you want to have that information, but you want to not be demanded of you all the time. Then you feel like Big Brother is watching. So it's an advantage to have been vaccinated. I want the public to feel that advantage, and I want it to be useful in areas where we would formerly have tested people.
Just along the same lines of encouraging people to get vaccinated, Rutgers University is actually mandating that all of its students before returning to campus in the fall are vaccinated with the COVID-19 vaccine. The Rutgers president said that, quote, adding COVID-19 vaccination to our student immunization requirements will help provide a safer and more robust college experience for our students. Do you have any thoughts on this? And do you think other colleges will do the same?
That's an even harder one to answer because I have a problem with the meningitis vaccine mandate that a lot of colleges have when there's almost no meningitis around. Here, you actually have a disease that's an enormous threat to our society, a diminishing one. We're actually defanging this virus right now with the vaccine. We're defanging it. But the other reason I hesitate on endorsing this policy is that it's not teens that are really the biggest risk. Right now, if the variants start to affect teens more and we start to worry about younger people getting hospitalized, then I might be more on board with that. We do, to argue both sides of this, Samantha, we do ask for teens coming to college or high school to present their MMR titers. They had a measles, mumps, rubella vaccine, they had hepatitis. In the medical center, we need proof that you don't have tuberculosis. So there's areas where this might become useful. I think he's ahead of himself. I don't think that it should be used for universities right now for entrance.
So my question is, the COVID-19 vaccine, for the most part, is still in emergency use. By putting that in place, is that even getting ahead of himself and Rutgers itself to, rely on this vaccine being readily available in the sense that all of its students could get vaccinated?
Completely agree with you. It is a way premature. And again, I think a lot of the country is rebelling against excess regulation and superimposed requirements. The fact that it's an emergency use authorization doesn't bother me much because 100 million people have taken a dose of it already and they're doing fine. I mean, this vaccine, we got to keep selling it, and we have to sell it person to person. It's an incredible accomplishment, as effective as it is and as safe as it is. But that doesn't automatically lead to requirement. It has a lot to do with where we are as a country, where the virus is. And as you pointed out, Rutgers getting ahead of themselves. Probably, I don't agree with it right now.
Dr. Siegel, thank you so much again for joining me. I really appreciate your insight and hope you'll join me again soon in the future.
My pleasure. Thanks for having me, Samantha.